Hi, I'm John Bass with Hashed Health. So today I wanted to talk to you about what's going on in the blockchain world in healthcare, specifically in supply chain. So first of all, let's talk about what is blockchain. Blockchain is a foundational new technology that's designed specifically to solve multi-party, multi-system issues of trust and transparency and incentive alignment. So it's great for supply chain where there are a lot of problems over the years that we've been trying to solve that we really have trouble solving company by company. It's a value chain problem or an ecosystem problem that's best solved if we collaborate together across our organizations. So there are a lot of CQO, cost quality outcomes related kind of initiatives, a lot of traditional legacy data management, interoperability issues, standards issues that I think a lot of people are very excited to have a new conversation around new types of solutions, new types of infrastructures that can allow us to more effectively and more efficiently solve some of those problems. What is a blockchain? A blockchain is a shared ledger, and there's a lot that you can kind of learn just by thinking about those two words, a shared ledger. First of all, a ledger is a chronological record of information that's important to a network, that shared network. So the information that's tracked on a blockchain or a distributed ledger are things like transactions or events or data points that shared community cares about. They're all tracking it probably in today's world, but they're tracking it individually or independently, and then at some point they're probably trying to reconcile that information with their trading partners. So instead of doing that, why wouldn't we create a shared ledger of that information that sits on top of our supply chain or sits on top of our value chain and allows us to have a shared source of truth that we can then build applications on top of. And that's what a lot of blockchain initiatives are focusing on, is creating a shared ledger of information that's shared across a network of business partners that are all trying to solve a common problem. So a lot of groups are coming together in a variety of different ways in today's world in order to realize the opportunities that are associated with this new technology. Over the last year, there have been 8 or so different major consortia initiatives that have been announced. Most of those consortia are in the amongst insurance companies or amongst pharma companies. But a lot of the newer ones are starting to attract a lot of health systems and GPOs and other traditional and non-traditional supply chain constituents. In 2018, a lot of the consortia were focused on things like provider identity. And the use of the technology enables us to solve the problem in a new way. It enables an interesting new business model that was kind of brand new and we think highly valuable. So I'll give you an example. Credentialing of physicians is a problem that health systems and payers have struggled with for a long, long time. And they've always struggled to do it in an efficient way by themselves. And so this is an example where a collaborative, cooperative community can solve it more efficiently and effectively than any one individual health system or insurance company can on its own. So the way it works is through the use of the blockchain to track, for example, primary source verified credentials. And so the blockchain is very good at the pedigree of a piece of data, primary source verified credentials being an example of that. And then we use that to basically create a digital asset that's made available by people who've curated that information or done that work to credential a physician, make those digital artifacts available on a digital marketplace, a peer-to-peer managed marketplace to other enterprises that need to do that same work. So one hospital will go credential a physician, will take 6 to 8 months to do that work, really curate that data set, and then they can turn those artifacts into digital assets that are then made available to others who need to credential that same physician. Instead of doing that 6 or 8 month process on their own, they can acquire those credentials from someone who's already curated that information. So it's taking this legacy data set that sits idle inside a health system today, but it's really valuable, and it's making that information available to a counterparty who finds value in it. This really cool, new, innovative business model that's enabled by the use of the technology, and that's a data market that's used to trade these digital assets between organizations. And the third important piece is that we have a network of business partners that are excited to use that. That's the consortium. So there's a consortium of large health systems, large enterprise payers, and other data partners that are all signed up as partners to bring that network to life. So again, you've got a meaningful use of the technology. The use of that technology enables an exciting business model, and there's a network of partners that are excited to bring that product to life. In 2019, there have been a number of other consortia, mostly in the pharma space, that have come to life. All the major pharma companies are now part of one or more of these consortia. One is called Melody. It's around federated learning, around enabling more efficient drug discovery. And there's a couple different projects called Remedy Chain and MetaLedger that are focused on track and trace in the pharma supply chain, basically Drug Supply Chain Security Act compliance. And then there are a few other interesting initiatives within the payer space. And now you're starting to see GPOs, health systems, and non-traditional enterprises such as Walmart and PNC Bank and others start to get involved in these initiatives as well. So we're getting beyond the point where it's kind of a question of, is blockchain as a technology real? And we're getting more into what are the specific use cases that are being brought to life, and what are the networks that are forming around those use cases. So I think over the next 6 or 12 months is going to be a really exciting time for AHRMM and the community of providers and manufacturers and distributors and GPOs that are actively involved. I think you're going to start to see new initiatives by some of the members and new consortia, new networks of members that are standing up and saying, hey, I think we can solve old problems in new ways using this technology. And I think you're going to see some of the results of those initiatives start to take form over the next 6 or 12 months.